Okay, guys, so I'm trying to do just a quick update video because I did tell you guys, I think, in my 5-month post exosome update that I had not followed up with my doctor yet. Sorry, I have like clothes up here. But I did finally have my follow up. It was, I think, a week after I made that video. So I'm trying to do this really quick to sort of update you guys. If you guys have not seen my GAD antibodies videos, I did upload them probably like a week ago. I made two, and one of them is like the GAD mystery or something like that. You might want to watch that first. That way you know what I'm talking about in this video. So I did confront my doctor because I wasn't sure why she was testing me for those antibodies, because she had told me at our previous follow-up that they weren't high enough for SPS. So basically, like saying, it was almost like saying you don't have it. You don't have SPS. They're not high enough for SPS. So it kind of, I was lost. I was like, then why is she pulling this number? Why is she testing for it? And she was telling me that it was going down, which it wasn't going down. That was the first time that we had ever tested for that number. So it was kind of alarming to me that I was testing positive when I had been tested for that number 3 times before by other doctors and had never showed up positive. I mean, I never showed up anything. There weren't any antibodies. So I cornered her and basically told her, look, my other doctor agrees with you. They're not high enough for a diagnosis of SPS. And she said that it's possible that they're just antibodies from the IVIG, because IVIG has lots of different antibodies, and it's possible that they could have just been from that, since I did the blood test probably like a week and a half after my last infusion. So she was like, oh no, they're from SPS and they're going down, because in my most recent blood test, they went from 80 down to like 8 or something like that. And I was like, no, I was like, they're irrelevant. I said, it's a completely bogus number. That's what the other doctor told me. And it was weird that she sort of completely switched her position on it. She basically was like, oh, it's SPS and they're coming down. Like almost like saying your SPS is improving. And I was like, none of my symptoms are better. I'm still worse than I was prior to doing the exosomes. So I just basically flat out told her, like, I'm not doing well. It's been 5 months. I'm still doing pretty terrible. I'm still having weird symptoms. And so I basically just cornered her with that, and she let it go. She stopped. Sorry, my arm is getting tired. I should have put like my tripod, but she stopped and she was like, she just kind of dropped it. And I told her, I said, I don't know why I was diagnosed with SPS if the antibodies aren't high enough. The other doctor gave me the best explanation she could, but this doctor, my immunologist, was not. I kept bugging her. I said, why did you pull those antibodies? Why are you testing? Because there had to be some reason that she was testing for them. There's something that she knows that I don't. Either the exosomes induced the production of these antibodies, or she's just screwing with me, I guess. So eventually she kind of let it go, and she is not running that test again. But again, she never really answered my question. So basically, I got kind of like aggressive with her. I'm trying to like find the best angle for my face. Sorry. I got like pretty aggressive with her with all the test results. The other one was the SED rate, which is completely normal now. So if you don't know what a SED rate is, it's an SED rate. I don't even know what that stands for, but it just can show if you have an acute infection. And my SED rate had been fluctuating a lot in the last probably over a year. I had been able to get it down to normal range on my own prior to the exosomes. So that's why I was kind of like, why is she testing for this as well? Because, she was like, oh, it's coming down, it's coming down. And yes, it's like very, very low, probably the lowest I've ever had it. But again, why are you testing for this? So I told her, what infection do I have? Like, what infection do I have? What, why are you pulling these numbers? What do these numbers mean? And she's like, oh, it's showing that you don't have infection anymore. I said, well, what infection did I have prior to this? And she's like, it could have been anything, like basically saying it could have just been any kind of infection. Like you just had something. Excuse me, sorry. Um, so it was almost like the vibe that I'm getting is that she's pulling these numbers. Sorry, this looks so gross. That she's pulling these numbers um, just to kind of make it seem like I am improving, like things are getting better. And she knows that these numbers are going to change for whatever reason. I don't know, it could be the exosomes, it could just be that they're changing. But I told her, I said, I've been able to get that number in range prior to the exosomes. So it seems like these numbers are very irrelevant. Um, Although the SED rate was the lowest it's ever been in a very, very long time. The thing is that I told her, so I'm still experiencing everything. I said I'm experiencing every single symptom, even symptoms that had improved, like my eczema. I actually forgot to mention that in my 5-month update, that my eczema is returning, and that was something that had completely resolved since starting the IVIG. So I just backed her into a corner. I got as aggressive as I could. I try not to be disrespectful, but I also wanted answers because I hate when doctors lie. Um, and I understand that this is an experimental treatment, and that's something that we all have to understand is that these treatments are experimental. There's no standard um, procedure for these types of things. And I told her, I said, it's been 5 months. I'm not seeing any improvement. I'm not feeling any better. I actually still feel worse. Granted, I'm not as bad as I was last month or at the very beginning, but I'm still slightly worse than I was prior. And so I kind of badgered her a little bit and really kind of, I'm paying this doctor. I paid for the exosomes. And when you're paying for something, I think you have a right to ask and demand answers. Um, so I just kept badgering her, and she said, she said, probably take about 8 months. She said, this is a dosage that the researcher, I don't like giving out his name or her name, but the researcher that she got these exosomes from and his research and his protocol was that dosage of over 300 billion. She said it's usually 3 or 4 infusions given every other day. Um, and each one is a 5 ml bag of that's about 110 billion exosomes. So she said that's what he's been using, I guess, in his research or in his studies with people, and that's what's been showing results. She said, and we're just checking in on you every couple months because it can take a long time. You may not see any results for probably up to 8 months. And I told her, I've heard it can take 9 months, it can take a year. And she said, there's no standard. She said, it can take a long time. It depends, I guess, on how bad you are or how long you've been sick, which all makes sense to me. But again, she needs to say that. Doctors need to say that from the very beginning. They should actually just say, you know what, I don't know. I don't know how long it's going to take. I don't know what your trajectory is going to be, given that, that I've been sick for 18 years and that I have a lot of neurological involvement. That's kind of what I want to hear. I don't want someone telling me you're doing better when I feel like absolute garbage. And so I did really just keep at it, and I felt really bad, but at the same time it's like I just paid so much money. I don't know if I've told you guys how much I paid for it, but I don't know if I even want to. But it's so much money, and it's, I don't understand how doctors can just be like, oh, you're doing fine. It's like I paid all of this money. The doctors, even though they make good money, these people are especially this particular doctor, she's very money conscious. I know that you know, she knows how expensive this stuff is. She wouldn't pay that much money for this treatment. So I think she can be honest with me, and doctors have to be honest with patients and say, look, this isn't a cure. It can take a very, very, very long time, and you're going to feel miserable. And I think she was aware of the fact that I was going to feel like crap, because she did tell me before I did the treatment that opioid medications are contraindicated with this treatment. So it was weird because I've never taken opioid medications. I've never had a need to. So I was like, why would she tell me that? Because I'm not, I've never taken them before. So she probably knew that I was going to be in some amount of pain, or that I might get desperate and want to take something stronger to help the pain. But again, she doesn't say that. She just, she's very like, not straightforward, kind of beats around the bush. And so I just really had to just keep at it until she was just like, well, it can take 8 months, and that's why I'm only checking in on you every few months. The first check-in was after 3 months. The second one was at 5 months. And then I don't see her again until September, until the beginning of September, which is another 2 months after my most recent follow-up. So, and that'll be about 7 months out. So I'm holding on to hope, you guys. Don't let doctors tell you that you're doing better when you don't feel better. Sorry, I'm getting kind of sweaty, but you know, ask questions, especially if you're paying money. Ask questions, bug them. You don't have to be mean or nasty, but you do have to be very stern sometimes, especially with doctors that are just kind of beating around the bush. I think one of the biggest things is that they don't want to get in trouble, because they know that they are not supposed to be using, well, technically I don't really know, but they know that there's a lot of gray area when it comes to using exosomes and regenerative medicine in the United States. And so I think they're very concerned about, a patient complaining and getting angry and reporting them. So I think that's part of the reason why she's, being very, I don't want to say coy, just being very like, kind of acting like she doesn't really know or something. But anyways, my neighbor has started blasting his music. I just wanted to add that, and let you guys know what happened at this appointment. And I really wanted this to be like a much more well done video, but I also want to get it out as soon as possible, that because I know a lot of you out there are also looking into this treatment, and I want to make sure that you have every bit of information before you make a decision like this, because it is an incredibly expensive decision. And I'm starting to see a lot of other things. For example, if I had been someone with a full-time job, which I'm glad that I'm not, I may have had to stop working for who knows how long, because I've been feeling so terrible. And I know a lot of you out there are still working even while you're battling a chronic illness. So a lot of these things are important to know, because you don't want to end up spending, you know, a lot of money and then having to quit your job or take an extended leave where you're not making any money, and then think to yourself, how am I going to recuperate this cash, right? So anyways, my neck is hurting from holding the phone. I'll try to upload this as soon as possible. If you guys have any questions, leave them in the comments. If you need me to make a video about anything else, let me know. Yeah, and that's it.